All right, good evening. Thank you everyone for joining us. My name is Lisa Klaslow. I'm with the Lupus Society of Illinois. I'm very excited about today's presentation on heart health awareness. It's going to be presented by LaShon. Just a few announcements about tonight's presentation. This event is an education purpose for educational purpose only and to serve and benefit our mission. The Lupus Society of Illinois does not provide medical advice or recommendations. This information should not be substituted or replaced by expert medical care. Before making changes to your medical care, consult your qualified healthcare professional familiar with your medical condition and health status. This event, again, is being recorded, and we will add it to the LSI website. Just a few upcoming events. The LSI Associate Board is holding a fundraiser on May 10th at Soldier Field. There's a soccer game at the Chicago Fire game. Tickets are $36 with a portion of each ticket going back to LSI. You can scan that QR code or find more information on the LSI website. Walk season is coming. We will be announcing our walk dates really soon. So be aware that we'll have those up in the next few weeks. And then if anyone is interested in helping plan the walk, we do have a walk committee. So let me know if you're interested. We have fulfilled our runners for the 2025 marathon. So that's very exciting. But if anyone knows someone who is an open runner and they would like to join or more information, have them give us a call at the office or email me. Again, if anyone is looking for volunteer opportunities or internships, again, we always have those available as well. So let me know. So I'm going to turn it over to LaShon in just a minute. I do want to give her an introduction. LaShon is a nurse practitioner, MSN, FNB, BC. She can tell you what all those are because I have really no idea. I know she is very hardworking. She has been a registered nurse for over 25 years. She completed her master's in nurse practitioner at Chambord University in 23. She is currently pursuing her doctoral degree. She is very active in the lupus community. I'm sure everyone on this call knows LaShon. She has helped implement educational programs, support programs, and help to organize and develop additional collaboration relationships. She is a mother of 3 intelligent and beautiful daughters. Having lupus has not deterred her from her goals and aspirations in life. She is passionate about health equality, health literacy, and overall health promotion, which focuses on financial health. So I'm going to let LaShon take this over. And again, we are recording. So once the presentation's over, we will open it to open discussion. So if you have questions you want to chat, great. But we'd like to have some conversation as well. So there you go, LaShon.
Thank you. Thank you, Lisa. Thank you. Well, welcome everyone. I do have a little cold, so bear with me. I might have, a few coughs here and there. Thank you guys for joining. So February, and Lisa did a great job. So those initials, Lisa, MSN is a Master's of Science of Nursing. APRN is Advanced Practice Registered Nurse. It's the same thing as Nurse Practitioner. FNP is my specialty family nurse practitioner, and BC means Board Certified. I know she gets caught up in those initials sometimes. So Heart Health Awareness Month. I wanted to do a presentation just to, really educate on some risk factors and numbers that we should know for ourselves. I also wanted to do a special presentation for people with lupus and also explain a little bit about the heart. I know we heard a nice presentation from Dr. Nika at last year's Rush educational event. So I hope you guys enjoy. We got a little case study at the end. And guess what? The case study is me. How about that? So enjoy. So this I titled Red Line Edition because it's red for heart. So one of the people say, okay, what is heart health? Okay, so my definition of heart health is knowing your risk factors for heart disease and minimizing the modifiable ones. So we have risk factors that are modifiable, which we can change, and we have risk factors that we cannot change. And we'll go a little bit more in detail about those. So in general, what is heart disease? So heart disease encompasses a lot, and some particular coronary artery disease is probably the number one. Um, and that is the heart vessel being sclerotic with buildup of plaques. Then we have congenital heart disease, and that's going to be situations that happen with the heart in the developmental or formation stage prior to birth. Then we have cardiomyopathy, which is involving the muscle itself. The heart is a muscle, having issues with pumping, heart arrhythmias. Everybody's heard of AFib. That's, things like that. Heart failure, which is a chronic condition. And I think one heart valve disorder. So we have four valves, and any of those valves can have problems with functioning. And then my last one, I think it's pericardial, is blocked by, yeah, pericardial, which is inflammation of the fluid, inflammation or fluid that is in the sac. So the heart is covered with a sac. And if that sac becomes inflamed or filled with fluid, that would be pericardial. So these are when people say heart disease, it can be any one of these, or it can be two or three of these, but definitely you need one. And then hypertension is not quote unquote considered heart disease, but uncontrolled hypertension leads to heart disease, if that makes sense. So we'll get a little bit more into that as we go. So hypertension, um, there are a lot of people who hypertension is a fancy way of saying high blood pressure. Okay, and as I stated before, although not listed technically as a type of heart disease, hypertension can lead to heart disease. So this is one number we should know. We should know our baseline blood pressure. A lot of women have undiagnosed hypertension. So we have a normal range. Let me see if I can get rid of this. Is the screen blocked for you guys with my picture? Let me see. Oh, there it is. Okay, got it. Okay, so I love when I ask someone, "Oh, how was your blood pressure today?" And they say, "Oh, it was good." Good. I say, oh, what was it? And they say 150 over 87. And I just look like, that's hypertensive. That's not really good unless you're used to being higher. So we want a normal of 120 at the top. That's the systolic number, and the bottom number, 80 or below. Okay. We're elevated when we hit into those 120s, above the 120. So we're 121, 122, up to 129 on the top level, the systolic. That's going to be elevated. That's not quite a diagnosis yet of hypertension. When we hit that 130 at the top, and then that bottom is hovering in that 80 to 89, that is stage one hypertension. So when we get to the 140s on the top number, with the bottom number being at the 190, then we're in the stage two hypertension. And then so on for stage three, which is listed above 180. And really that's stroke level blood pressure. So definitely if you have hypertension, it's a good idea to monitor your blood pressure and kind of track it and trend it to kind of see if certain things are elevating it. Statistics, very important. Heart deaths, heart disease deaths vary by sex, race, and ethnicities. Heart disease is the leading cause of death for people of most racial or ethnic groups in the United States. However, it is the leading cause of death for men, women, and people of all racial ethnicities. One person dies every 33 seconds from a cardiovascular disease. And I remember we talked about that circle with those 5 or 6 different heart diseases there. One, that's really one in every 5 deaths roundabout. And heart disease is costing billions to manage. For Black women in particular, um, we have higher incidence of cardiovascular disease at a higher percentage. So women in general, it's high, but it's higher for African American women. 59% of Black women ages 20 and up are living with some form of cardiovascular disease. So that is very important why, this Go Red month is good to do some education. Black women have the highest percentage prevalence of hypertension, and only 25% of those diagnosed have it under control, where it is, you know, steadily maintained at a decent level. So this is very important. So we talk about prevention, we talk about health literacy, we talk about, knowing risk factors and things, but today if one person learns something, that's great, that's kudos, I feel like a job well done. But if something tonight saves someone's life, that's even better. Risk factors, we talked about modifiable, changeable ones, and non-modifiable ones you can't change. So we'll start with the modifiable ones. Okay, so hypertension itself, it can be modified with, diet, exercise, medications. Okay, smoking can be modified. We can stop, we can cut back. Cholesterol levels are modifiable with, again, diet, exercise, medication, and activity. So we all know the heart health CDC or American Heart Association recommendation of 3 days a week, 30 minutes of, activity. Our weight is modifiable. Okay, so weight reduction, diabetes is a modifiable. You have diabetes, but maintaining and managing an A1C that is controlled, that's the modifiable part. So things we cannot change. We cannot change our race. We cannot change our age. We cannot change our gender. Um, History, we cannot change. We cannot change family history. We cannot change previous history of stroke or heart attack or cardiovascular event, we call them. And we cannot change, for most of us, we have lupus that are on this call. We cannot change that status. Lupus and or other autoimmune, just can't change those. So those would be our modifiable and non-modifiable risk factors. Okay, so one number we should know is our blood pressure. Another number we should know is our cholesterol. We should have an idea. We should have an idea of where we are. If everyone gets an annual physical screening, usually the doctor's drawing blood, usually they're checking things like this. So we have our good cholesterol, we have our bad cholesterol, and then we have our total cholesterol. Those are usually the three um, numbers that they look for. So here are just some ranges. When you're at a healthy level, your total is under 200. Okay, your LDL is under 100, and your HDL, we want that above 60. Okay, when you're at risk, when you're floating somewhere in the middle, you're at risk, but you're doing okay, but you could do better. That's the middle column, and that's where that total is going to be 200 to 239. We really want it under 200, obviously. The LDL under 100 is ideal, but if you're pushing it 100 to 159, you're at risk. You're considered at risk. You're not considered in a dangerous zone yet. HDL, we want that up to 60. When you're 41 to 59, you're considered at risk. So obviously, dangerous levels are in the last column. And really, this level here, so at that at-risk level, at-risk level is usually where lifestyle modification will be recommended or suggested by your doctor. Diet, exercise, the main two, smoking cessation if you smoke. On the dangerous level, by this point, you're probably on medication at this point. So someone asked me about this picture over here, the cholesterol. This is an artery, okay? And so if you can see where the pointer is, this one is normal. That's just patent and wide open, and able to freely move blood. Okay. The second one here where I have it is starting to see the little yellows, uh, and that is fat deposits. Those are plaques that are starting to adhere to the endothelial layer inside. Okay. And then that's really just kind of scattered there. You can't really see it. It's elevated. So, because we really want none. So you got a little bit, it's elevated. Okay. Then we got a high on the third one. You see more yellow around the edges. So if you notice what's happening is as that buildup, as that plaque, and it sticks there. It's just stuck. It is not floating. It's stuck on that inner lining of this vessel. Okay, so as it builds, the plaques build, it narrows the space for blood to flow. Okay, so that could be very dangerous. That could cause a blockage. Can reduce blood flow, and we'll talk a little bit more about that later. So this red flag, this picture of the flag, that's the red flag. Okay, symptoms of heart disease, and these are symptoms. If you have one of these, doesn't necessarily mean that, but it is most likely that you do. Chest pain, chest tightness, and people sometimes like to normalize chest pain, but I'm here to tell you chest pain is not normal. It's just not normal. Chest pressure, chest discomfort. So people describe pain different ways. People describe chest tightness, squeezing, discomfort, elephant on the chest, uh, sharp, uh, radiating, starts in the middle, then goes over to the arm, all different ways to describe it. But at the end of the day, it's chest pain. Shortness of breath, um, everybody know what that is. It's hard to catch your breath. It's hard to talk and breathe at the same time. When you're walking, your breathing, it becomes more difficult, shortness of breath. Pain in the neck, jaw, or throat, or the belly or back are other signs and symptoms. Pain, numbness, no, well, not tingling, numbness, weakness, or cold extremities, coldness in the legs or arms. Um, that's usually when the blood vessels are narrowed that you might feel that. Um, you might not be diagnosed with coronary artery disease until you have a heart attack, angina, which is chest pain, a fancy way to say chest pain, or stroke. Unfortunately, sometimes heart disease is a silent killer, meaning we don't get a warning. You didn't get clues. You didn't get a roadmap to it, leading to it. Kind of comes on suddenly with no rhyme or reason. That does happen. Does happen. Um, so symptoms can be a little different for men and women. Anxiety can be because you have this nervous energy. It's like you feel something, but you don't know what. And nausea, vomiting. So that's more so in women. Um, Men, not so much, but it could, and stomach pain. So these are some different ones. Perspiration, sweating profusely could be a sign. So these are just additional signs. And swelling in the legs, ankle, or feet is a huge sign. And that one is usually indicative of a heart failure. So we talked about knowing numbers, okay? So normal weight. Why is knowing your normal weight important? Because if you suddenly put on weight and you have swelling, it's good to know your baseline. So we have a gauge, a place to start in terms of knowing how much weight you're actually holding. Is it fluid? Is it something else? Height is good, not so much for the coronary arteries or the hearts, but more so and if you need medication, accurate height if you know it. Blood pressure baseline, we talked about the blood pressure. So everybody should know their baseline, where their average is. If you're diabetic, you should know your A1C, and then the cholesterol levels that we talked about. So special considerations for our lupus population. Okay, so lupus in itself as an autoimmune puts you at a greater risk of having heart disease. Um, so we talked about that endothelial layer, the inner layer where you saw that those yellow plaques building up. With lupus, when we have our flares, when we have our uh, attacks, because it's basically our body is attacking itself, that area can become damaged as well as the valves. Um, and over time, depends. Everybody has different, when you have systemic lupus, you have organ involvement. And some people have involvement with the heart, others don't. But we all know with systemic lupus that since any organ can be affected, it is possible if you don't have heart involvement now that you could later. So it's good to just know that that is a risk factor that's not modifiable. And really, the only thing we can do is what we always try to do with lupus is which is control the severity and frequency of flares. We can't stop them. We just can't stop them, but we just try to control the severity and the frequency of the flare. So anytime our organ get a hit or attack with a flare, whether it's the joints, whether it's the lung, whether it's the heart, whether it's the kidneys, whatever it is, usually that is not repaired. Okay, usually that is over time, it's just more damage that eventually builds up, basically. So blockages in the heart arteries, leaky heart valves, inflammation and irritation around the heart lining, and heart failure. These are some considerations for people with lupus that could happen. So barriers to care when we have all this going on. Um, in general, symptoms are not taken seriously all the time, but in particular, for lupus patients, symptoms are not taken seriously. Um, there's still knowledge gaps and knowledge deficits regarding lupus, and that's for the general public, but that's also for providers, for doctors, nurse practitioners. It's still, unless you're a rheumatologist or dermatologist or nephrologist or someone who actively treats lupus patients, there is still that population that has a knowledge deficit. Then we have the biases and stereotypes that come with seeking care, what you should look like. Um, we'll get more into that. Actually, we'll talk about it now. Uh, I'm the case study. So I'm Black, I'm overweight. So the assumption or the stereotype is that I am diabetic, have hypertension, have high cholesterol. I have none of those things. So it's just, or that you're lazy. And then with lupus, we have stereotypes that come with that, and usually it's that you're unmotivated and that you're lazy. So these type of things cause barriers to us getting care, uh, proper care, timely care, adequate care. So because lupus is unpredictable, that is a huge barrier to care. Because some days you look and feel fine, other days you can barely drag out of the bed. So what type of care you need, how consistent, if you need adjustments in medication, if you, it's really hard unless you're in a flare. But when you're unstable, that's when your lupus is active and you possibly could be unstable. Um, the clinical picture may not match your symptoms. Classic that for certain people, clinical picture does not match the symptoms. And again, I'm going to use myself because I'm the case study today. Um, my clinical picture over the last month has probably looked like I look tired. I've been in a lengthy flare for I want to say since December-ish. I'm on the tail end. Thank goodness. Thank God. Um, most of you know that around February 2nd or so, I was having some chest pain and shortness of breath. Sternal chest pain, like right here, and shortness of breath. So with my lupus already having lupus pneumonitis, which is inflammation around the lung, I was used to having shortness of breath periodically and a flare. Chest pain totally new, totally threw me off. Right away, I called my doctor's office and said, "Hey, I'm not feeling right. I'm in a flare, but never have chest pain. Could you enter some orders for the EKG and an echo?" And of course, they said, "Oh, yeah, sure. We'll enter them right now in Epic and go get that done." And okay. So did that. Both came back abnormal. So I thought about that. I said, "Oh, okay, the EKG is abnormal." It showed T wave abnormality. I didn't get overly concerned because I know inflammation can cause that, and I'm in the midst of a lupus flare with inflammation everywhere, so I didn't get too nervous about it. I actually just, said, okay, we're going to wait for the echo. I actually had the echo 2 days later because that was as soon as they can get me in. And then 2 hours later, I got the ping on my phone that the my chart that the echo was back. So I said, okay, let me look at the echo. I looked at the echo, and I didn't have my glasses or contacts and so I was like, I wasn't sure what I was seeing. So I got up and I put in my lenses in my eyes so I could make sure I was seeing this. And I saw some concerning things on this echo. So this echo showed a valve issue, mitral valve regurgitation, which I never in my life knew I had, is showing at a moderate level. And then it shows some other stuff. So I text my doctor. I said, "Hey, did you see my echo?" They said, "Yeah, a little concerning." I said, "Yeah, concerning. Let's go ahead and NT up and let's get the stress test because I'm still having the chest pain." We up the steroids, thinking it's the flare. Okay, still having it with exertion only. At rest, no problem. When I'm walking, trying to walk through the house or in my office, pain. So I try to relax, wait for the stress test. Okay. The doctor called me back. He said, "You know what? On second thought, you scare me because when you change fast. Let's go. Let's just have you go in." I said, I think that's a good idea. So I went and presented to the emergency room. Okay, so the emergency room, get the whole story, sternal chest pain, shortness of breath, history of lupus, abnormal EKG, abnormal echo. I need a cardiologist to evaluate me, and I would like to get some other diagnostics. So they put do all my vitals, get me in a room, hook me up to their tele. So I said, "Doc, don't you think since I'm having sternal chest pain, maybe we should get me a remote monitor so I can walk to the bathroom and walk around so you can pick up the palpitations and see when I'm having the pain, like what's going on." "Oh, we're gonna just hook you up on a monitor. Let me go check your labs and do a I was like, "Okay, go review my chart. That's a good idea. Let's start with that. Go ahead."
LaShon,
So he's reviewing my chart. I'm laying there. Yes.
sorry to interrupt, but you're kind of cutting in and out.
Okay. Would you like me to switch over to the
Yeah, I'm thinking the phone.
phone?
You froze a couple times during the presentation, but it picked right back up. But now you froze a
Okay.
couple times.
Okay. I'll switch over
Okay.
on that audio. Okay.
Yeah, because
Give me a minute.
we want to get the whole
Okay.
story.
You want to get the whole story? Okay. Let me try to do that. Hold on.
Okay.
Give me a second. Okay. 1 second.
Recording in progress.
Okay, can you hear me now? Uh-oh.
Yes, but there's an echo.
Mm, I'm gonna leave this screen on. You good now? Can you hear me?
Yes, we are good. Thank you.
Okay, I had to shut it off over there, so you'll have to pull up the slide if you
We
don't
were in a
mind.
perfect spot. You were going to the bathroom, getting a monitor.
Yeah, yeah, okay. So he comes back, the doctor comes back and he says, wow, I just reviewed your labs for the last 5 years. And you don't have high cholesterol, your A1C is low, I don't see anything that's been concerning. I see that you just, had some flares over the few years, here and there. He said, so I think that, I think that you're okay, that we can just have you set up outpatient to see the cardiologist and get the stress test. I said, well, you don't think you want to see me walk and see how the heart rate shoots up into the hundreds and evaluate my chest pain after I'm moving? Because I don't have chest pain when I'm not moving. I've been laying on this cot for an hour. He says, yeah, I know you think. I says, I honestly think the lupus is affecting my heart. I said, it's never had before, but the heart and lung are best friends. And I think my lungs got lonely and grabbed my heart, and the lupus is attacking it. And I've never had chest pain. He says, well, I said, you know what? Go call my rheumatologist. Can you call my rheumatologist and PCP and get their way in? He says, okay, I'll call them. He comes back with discharge papers. I don't know if he called anybody or not, to be honest with you. And so I said, you know what? Okay, I'm being discharged. And I didn't get to see a cardiologist. So fast forward, I come home and I lay down. Like I was in observation for like a few hours. And over the week, the next week, same thing. I go to the bathroom or walk 400, 500 feet. We increased the steroids. So the steroids allowed me to go further in distance, but the chest pain still came. So for the 2.5 weeks between that time and last Thursday, I think I left the house just 3 times, short times, because I couldn't really do anything. My quality of life was just really poor because I couldn't do anything. Like taking a shower would take me an hour and I would have to stop to breathe in between washing and rinsing. And I was just like, this sucks. This absolutely sucks. Last Thursday, I was feeling the same, poor, and it got worse. So after a work meeting at like 10:39, I clocked out and I text my boss and said, hey, I punched out. I'm going back to the hospital. I packed a bag. I showed back up to the hospital and I said, look, I'm not leaving today. I have a bag, which means I'm staying overnight. I got my hair up. I got it tied up in a silk scarf, which means I'm spending the night. And I said, I need to see a cardiologist today. I said, and a matter of fact, I would like the AVP or the Vice President of Guest Patient Relations to come down and talk to me. I need to see a cardiologist and I need some diagnostics on my heart. My lupus is attacking my heart. I don't know where and how, but I know I don't feel good and I have chest pain intermittently when I move. That's not normal for me. It's not normal for anybody. So they got me hooked up again, put me in a gown, did vitals. Your blood pressure's fine. Your heart. I'm not here for my blood pressure. I don't have hypertension. I'm here for my heart. Something is going on. Finally, a cardiologist comes in the room. And I said, thank God somebody listened. He listened to my history with lupus. He listened to my symptoms over the last 3 weeks. He listened to everything. He reviewed my medication. He says, tell me about the lupus one more time. You were diagnosed when? I said 2011 officially. He says, what does that mean officially? I said, that's my official diagnosis in 2011, but I probably had it years before it was diagnosed. He said, okay. He says, well, let's do this. How about he says, you probably can't walk on a treadmill right now because of your breathing and chest pain. So let's get a CTA and let's start from there. I said, that's the most sense anybody's made. Let's do that. So I get prepared to do that. Um, he says, probably going to be okay, but let's do it. So, Lisa, if you could pull the last slide, can you pull that up?
I made you co-host again. Let me see.
But see, I'm on my phone, so
Okay, let me see. Give me a second. Did you did you send it to me?
um, I'm not sure if I sent it to you, but somehow I will send it to you right now.
Okay.
But in this last slide is a picture of, yeah, we got to pull this up. Um, Picture of the CT scan that they did. Um, it's coming to your LSI email right now. Okay. And you should have it. It's sent. When these results came in, he told me this test, CTA, is checking the arteries of the heart. He came back to my room about an hour after that test was done, hour and a half or so. He looked at me, he said, we got 10 minutes to get you down to the cath lab. And I'm looking, my daughter's looking. I said, what do you mean? He pulled out the film and he showed me that I had a 90% blockage in a major coronary artery. Coronary artery would be a heart artery. So I looked at him and I said, I could be dead. I literally could have died any time from the day I left the hospital the first time to this day that I've come back. And he said, they're coming for you on the cart. We got 10 minutes. This doctor has pushed back 3 other people to fit you in. So I jumped out of the bed, ran in the bathroom with my daughter to help sponge bathe me. Okay, guys, if you see where um, towards the left, it looks like a broken connection between this long, yeah, right there, right there. Yep, Lisa, right there. Stop right where that black spot is, that dark, right over to the left. Right there. It's hard to see, but that right there is a 90% blockage of my LAD, left ascending, anterior descending artery. That artery is responsible for pushing blood to the body. So I had to have a stent placed in that spot, one stent. When he came to give me these results, he said something that just blew my mind. He said, all your other arteries were 100% clear, no plaque anywhere. He said, as a matter of fact, this finding of this blockage is soft. What that means is it wasn't something that's been sitting there growing and getting worse over time. Like, let's say if I smoked or just ate terrible all day, every day, and it just built up, it would be hard and calcified. This, this blockage was soft, meaning acute, meaning just happened, meaning like from the time of the flare, most likely. And so, literally, when I said my lupus is attacking my heart, I feel that. I don't know where and how, but it is. And that's what it was right there. So, all that to say, it's so important to advocate for yourself. And you know when you don't feel right, and you know when some symptoms are new, and you know what's normal for you, and you know, like, it might take going to another hospital, it might take seeing another doctor, but I just thank God that that day that it was in me to punch out from work and get back to the hospital and demand to see a cardiologist and demand to have further diagnostics. It doesn't matter how educated you are, it doesn't matter who you are. At the end of the day, I didn't fit the clinical picture of what that first doctor in the emergency room observation. I didn't fit his image of what I should look like. My chart did not match what I look like, meaning I didn't, no hypertension, no hyperlipidemia, no diabetes. He totally discounted my age, my race, and my lupus. Those three things alone put me at risk for a cardiovascular event, which is this right here, which is what I had. So that leads to the case study, if you could pull up that. Um, so I see Levita's question, or comment she put, and he didn't listen to you. No, he didn't listen to me. He tried to convince me that my chest pain was just a lupus flare and that increase in the steroids would help it. Now, plausible, steroids could help decrease inflammation. So if I have inflammation causing pain, then in theory, steroids could help it. But palpitations were occurring, shortness of breath occurring. It was too much going on for me to not feel like something was happening with my heart. I literally felt like I was having that day many heart attacks. So, February being Heart Health Awareness, I wanted to share that. And not for any attention or anything, but just for, again, if I could help one person and one person with lupus be able to stick to what you feel. Because at the end of the day, we know our bodies, we know our lupus better than anybody else. I know my lupus inside and out, and I know it was attacking my heart because the story was just not adding to anything else. Again, the no smoking, the blood pressure control. I wasn't thinking I'm just having a stroke or heart attack here. I knew or felt the lupus was contributing to some way, and that I needed to figure it out, and I needed to figure it out fast. And I'm glad this cardiologist put the pieces together and listened and got additional diagnostics, because I would truly be dead. I would be dead. So I can open it up for questions now.
Yeah, if people, anyone wants to unmute or throw them in the chat, just a reminder, we are recording, so feel free to put your camera on if you're comfortable, or you can leave it off. But if anyone has any questions or want to share a story that's similar, this is open. LaShon, do you want me to still share the screen, or do you want me?
No, we can just have discussion now. I think I covered everything that I wanted to show, really just reinforcing knowing our risk factors, knowing our numbers, and knowing symptoms. I mean, even a symptom of nausea and vomiting could be um, a sign of a cardiac event, to be honest with you.
So, I'll start, and I know I brought it up a little bit before everyone logged in. What is going to be the new for you, with your lupus? Are you still seeing that cardiologist? What's the schedule like?
So now, in addition to my regular medical team, which is my PCP, which is my rheumatologist, and when necessary, pulmonologist, dermatologist, now I have to add cardiologists to this mix. I have a stent in place, and that's going to need to be monitored and checked routinely. I had medications added to my list that are at least 6 months to a year, and they might want to do that aspirin longer than that, baby aspirin every day now, as well as, excuse me, a statin. And again, Keep in mind that I told you guys there were no hardened plaques in my arteries anywhere. I had a soft find, which was an acute one. Lupus was probably hitting that endothelial layer of that artery, and just the weakening of it, stuff just collected right there and built into that 90% blockage. So there's a new normal for me, Lisa.
Okay.
LaShon, I appreciate this is Lavita. How are you? My camera's off because I'm just in the bed. But um,
Because you
my
have lupus and you're tired at 8 o'clock. I
oh
know.
my goodness, I am. But I want to thank you for sharing this story because, and I want to thank you for sharing your journey, what happened with you, because we always say in the lupus community that you have to advocate for yourself. You have to, when your body's not feeling well, and that yes, sometimes the doctor will tell you this and tell you that, but your body, and you have to push. And sometimes we get tired and we be like, okay, well, the doctor said this or the doctor said that. And I remember one time they gave me high blood pressure medicine because I was in so much pain and my blood pressure was up, but it was due to I had pain. But the lady, the emergency room doctor, prescribed me high blood pressure medicine, and I almost died off the high blood pressure medicine because I was not supposed to be taking that. And but I kept taking the medicine because the doctor said I needed to take this medicine every day, twice a day, whatever it was, I was supposed to take it. And I was turning gray. I was sick. I was so sick. I was still sick. And happened to go to my regular rheumatologist. She was like, who gave you this? And I said, the emergency room said I had high blood pressure and they gave me this medicine. This medicine is killing you. It was killing me because I was not supposed to be taking that because I just had pain. I was having so much pain that it raised my blood pressure up because of the pain, because my pain wasn't managed. It wasn't that I had high blood pressure. So we have to know our bodies, and we have to know to advocate for ourselves. And that's a big thing that we're always pushing, that we're always saying. And a lot of people are so scared to go against what the doctor is saying because they're the medical professional. They're so scared to stand up for themselves and say, hey, look, that's not working, and I still feel like this treatment is not working. Like, can we try something? Some people are afraid to do that. And I'm glad that you told us this, and how you was like, you went back to the hospital. Sometimes we don't want to do that. It's a task to get out the bed and go back to the hospital, but
But you
you
know,
went
Vivi, I
back.
felt like I was dying, though. Those palpitations. My Fitbit. I was wearing my Fitbit, and my Fitbit was shooting up to 100 and something on my heart rate. And I'm like, I am sitting down on a phone meeting. How is my heart rate like this?
Mm.
And so I was like, I gotta go back.
But this is really, I appreciate you sharing it. I know you shared it with me before, and just to share with all of us, it is an eye opener. It's an eye opener what lupus can do to us. It's an eye opener, what we need to be looking out for just in case. It's an
Yeah,
eye opener.
yeah. But people with systemic lupus just be on guard that any organ can get attacked. So,
Yes,
I mean, your eyeball could get attacked.
yes, yes. And I thank you for sharing. I really thank you
You're
for
welcome.
that. And I do, and I actually have a friend whose eyes are being attacked right now. She thought she was gonna have to have surgery in her eyes, because of the lupus.
Well,
Yeah.
Because of lupus, yeah. So, yeah. But thank you for sharing.
Hopefully, I can save somebody else from having angina or a blocked artery or any cardiovascular event.
LaShon, I know you mentioned February 2nd, you started having chest pains. Was there anything leading up to it that now you think back and was like it was happening a little sooner? Or did it just like
I
come
mean,
on like
you know, yeah. So I think I had mentioned I had been in a flare really since December.
Mhm.
And so what flare means for me, I was extremely fatigued. And you gotta remember, I had two deaths in the family. I traveled twice to funerals. Then I wanted to see my papa before he died. So I took another trip to see him. So, and then that's just, okay, we had brisk cold weather here in Chicago. We got like below zero type of wind chills, okay? Um, then everyday life, you work, you do school, you do whatever. Um, if I felt something, it wasn't paralyzing me. It got to the point where that 400 feet walk paralyzed me to where I felt like I got punched in the chest and it was backing up my throat, if that makes sense. I had this pain in my throat. So, I mean, most people have chest pain, but they confuse it with heartburn or indigestion or something like that. I wasn't confusing it with that. I just somehow in my gut, I said, this is the, pardon my French, I said, this is the damn lupus. I said, it has to be because nothing else makes sense to me right now.
All right, does anyone have any questions? I know everyone's muted. I'm happy to unmute or put them in the chat.
Good evening, everyone. This is Stacy. Thank you so much, LaShon, for sharing your story. This is really, um, it just hit home, I guess. I know and love you dearly. So when this was happening, this was extremely scary just to know, what's going on. But it begs the question I keep thinking about is transparency and like not competency but like cultural competency on like the medical staff part and just like really listening. And so it just like makes me think like the times that we all may go to the emergency room or to the doctor and express pain, but sometimes not being in the medical field, we listen to what who we call the medical experts are. So this is a good reminder to that you are the expert of your body. And if
You,
something is not
yes,
right, keep at it
yeah,
until,
yeah.
you get it figured out because we can't expect the doctors to do that all the time. So thank you so much for sharing.
You're welcome, and thank you for coming to see me in the hospital. But I gotta say this, you know, ED physicians, they know a little bit about everything. Let's just put it like that. They're not the specialists in lupus. They're not the specialists with heart issues or liver issues. But I think when they don't listen to what the patient is saying and get out of their head what you should look like. And what I mean by look like is, or that the clinical picture doesn't match the physical picture. So my clinical picture, no hypertension, no diabetes, no hyperlipidemia, normal labs for 5 years, maybe didn't match the physical of being overweight to him. Or maybe not having, because of the weight, not having these things didn't match for him. Whatever didn't match for him, he was not receptive to me saying, it's my heart, because he had nothing supporting that. He had normal blood pressures, other than my symptoms, which went unheard: chest pain, shortness of breath. Not just chest pain, I reported exertional chest pain. So healthcare people know what that means. So what made him not like prioritize those two complaints over anything that he was imagining a picture in his head of what I should be looking like? I wasn't bowled over the cart, maybe because I wasn't screaming for some morphine. I don't know. And another thing is I was never once offered pain medication for my chest pain. That was incredible to me. And I said, well, I'm gonna ask when she comes back, the nurse. And I said, you know what? I'm not gonna ask. The next time every time she took vitals, you know what goes with vitals? Pain assessment. What's your pain level now? The same that it was before, 8. I didn't get anything that would take it away. I think my answer was something like that. So she would chart the 8. So I'm just like, I was always trained that you assess and then you do an intervention, then you go reassess to see if the intervention worked. So I couldn't worry about that. I was too busy trying to see if I can get some diagnostics and get a cardiologist to see me. So I didn't focus too much on the pain because think about it, I had been dealing with it for so long as lupus warriors do. We deal with pain every day. So me being at a 7-8 is nothing. It's just the fact that it was my chest. It was something going on with my heart that I didn't want to get missed. And it just got overlooked. I see somebody put in here, yes, because although my issue was not with the heart, I experienced a doctor not listening to my spinal concerns. I too did not leave until scans, MRIs, etc. was conducted. Way to go. Continue to advocate for yourself. Thank you, Sharana. Yeah. Yeah. So that's my heart health for everyone. I hope it helps.
Yeah, I mean, it shows that, you really have to fight for yourself and advocate. And we know you're educated. We know your daughters are educated, so they're there to support you, but still people aren't listening. So it's very shocking that they didn't take your concern the first time. And we are very grateful that you went back.
Oh, yes, thank you. Somebody put, this might be a stupid question, but I have diabetes and I check my blood pressure every day. Why does it, when I lift my arm up, it comes out normal? Gabby, so I probably would need a little bit more information with that. Um, you have diabetes, so I would be more concerned if you are checking your blood sugars every day, and I hope so. So you check your blood pressure every day. I'm going to assume you take blood pressure medicine because I don't know why else you would be checking it every day. Um, it should not be checked with your arm lifted up. Your arm should be at rest in a neutral position. It should not be lifted up. So I don't know if you mean lifted up on a table versus hanging down on your lap. If that makes sense. Usually we get a difference when we do a standing and a sitting. So if we're sitting and we check and then we stand, sometimes we get a drop. I don't
Yeah.
know if I answered your question.
Okay. Can you hear me?
Yes.
Yeah. Okay. Yeah, I check every day. And when I put my arm like in the air, like in above my heart, it comes out normal. But when I bring it down, it comes like 135, 140. And so
So I'm gonna say this. I don't recommend that you check it with your arm extended in the air.
okay.
That's not gonna be your accurate reading. So
Okay.
if you think about that, what you were saying that you lift the arm above the level of your heart, so maybe, the blood flow is affecting that, but that is not the correct way to check a blood pressure.
Okay. Okay.
So your number at rest with your arm neutral is
Yeah.
probably your more accurate number, and that is
Yeah.
a number you should know for yourself. And I'm going to assume you're using a electronic, like digital monitor. Maybe
Yeah.
try checking on both sides, the right and the left, to see if you're noticing a difference. But negative on checking it with the arm extended up in the air. That is no, ma'am.
Okay. Okay. Yeah, I have a test gun that I have on to check my blood sugars. So that
You have
helps
a
a lot.
Dexcom. Okay. Well, good,
Yeah.
good, good. So keep that controlled and keep your blood pressure controlled because both uncontrolled diabetes and uncontrolled hypertension could lead to other things. So try to get them both on some reasonable. Do you take blood pressure medicine?
Yeah, I do.
Okay.
Yeah.
Okay.
Yeah. Thank you.
You're welcome.
All right. Well, I think we will wrap up here. So, LaShon, thank you so much. I know this was very eye-opening to everyone on this call. Ooh, K Mims is Cecil's even giving a round of applause in there. Thank you, Cecil.
Lisa, I just got to address this one more.
Yeah.
Tashana put, you have encouraged me to seek a cardiologist. I have pericarditis as well as lupus, but I get chest pain there. Yes, ma'am. If you have a diagnosis of pericarditis, you should have a cardiologist on your care team.
Sorry,
Uh,
that did not come to me, I don't think.
that, yeah, I saw that word.
Okay.
Uh, yeah, I wanted to address that because that's important. Yes, get a cardiologist.
Oh. Teresa, did you have something to add? Thought I saw a hand up.
No, I was just clapping for
Oh.
her.
Thank you.
You're clapping, Teresa.
Awesome. Well, thank you again for everything. Oh, you're getting all sorts of claps and waves here.
Okay, thanks for having me,
Well, we
Lisa.
appreciate it. I do want to say that when you called me 2 weeks ago, I was like, we have to get this in. Like we need to talk about this. And then you even
That
had
was even before the
that
event
was
of last
before.
week.
Yeah. Oh, look at K Mim. She's getting fancy with the hearts. Look at so and then yeah, I felt like you had more to even share after what happened, but we appreciate you always for all that you do for the lupus community, the LSI community. So we thank you being so open and honest and educating all of us. So thank you everyone for joining. Again, this will be recorded. I'll get this loaded in the next couple days. I'm not a tech person, so we will send it out and probably e-blast the link, but it will be on our website. So thank you everyone.
Thanks, everyone. Thanks so much.
Have a good night.
Bye-bye.